Hello, this is Father Jeremy from the parish of Our Lady of Hainsford. As one of the Archbishop's advisors on healthcare, I'm just recording this to share some reflections with you about hospital chaplaincy, which are maybe particularly relevant during this pandemic. As a bishop's healthcare advisor, a few years ago, I had the interesting experience of teaching a course on hospital chaplaincy in America. And you can always gain really interesting insights by going into another country and another culture. But one of the things that really struck me most was that they had a very different attitude to the idea of a publicly funded healthcare system than we do. Because I think the vast majority of us, even before the pandemic, have a real esteem and indeed really love for the National Health Service. It's unfortunate that this isn't reflected in the pay and conditions of many healthcare workers, of course. And since the pandemic started, we've seen this expressed in many obvious and clear ways. We've seen the rainbows that people have put up in their windows, and in one case that I saw recently, chalked on a pavement outside their house. We've seen the institution of clapping for the NHS and for care workers on Thursday. And recently we had the famous street artist Banksy joining in by donating a really touching drawing of a small child discarding some superhero figures in favour of the figure of a nurse with her cape flying out behind her, clearly showing that in Banksy's view, the nurses and the healthcare workers and the carers are the new superheroes. One of the wonderful things about healthcare, or about the NHS in particular, is that chaplaincy and spiritual care were right at the heart of it, from its beginning in 1948. And over the years, when there have been threats to the position of chaplaincy and spiritual care, I have seen heartening signs of the widespread support that there is. When there was a threat to the provision of a proper hospital chapel in a new hospital, many staff joined in a wave of protest about this. And many of them hardly ever went to the chapel, certainly weren't regular chapel goers. But there was a real feeling throughout the hospital, throughout all the staff, let alone amongst patients and their relatives and loved ones, that a hospital wasn't proper without a chapel. And a few years ago, when one trust in the West Midlands tried to sack nearly all its chaplains, then again there was a widespread protest against this. And Cardinal Vincent, who was then our Archbishop, said that memorably that we are not machines that need to be mended. We are people with complex needs. This pandemic, of course, has brought its own challenges to the ministry of chaplains, who have always been involved and have been at the heart of care in hospitals. They've always been used to working with people with serious illnesses and to working alongside other staff as well. But of course, during the COVID crisis, like all other NHS staff, chaplains have had to be fitted for personal protective equipment when it has been available. They have not been able to minister in the same ways to patients. And indeed, in some cases, they've not even been able to access patients. Chaplains have tried to carry on their ministry and have adapted and have shared best practice with each other. They have sought to assure people of prayers. They have sought to enable other healthcare staff in cases where they haven't been able to access patients to minister to patients and to say prayers with them. And it's been a fantastic feature of this crisis that the chaplain's ministry has continued to be valued and has provided a support. Maybe particularly in the sad times when people have not been able to visit their relatives and loved ones, and not to be able to be present with them at the last moments of their lives. So then we continue to have a high opinion of the NHS. We realise how important it is, and we hope that that new perception of the NHS will continue after this crisis. Maybe we can add our voice to the voices of those demanding that those working in healthcare and as carers are properly paid and have proper conditions. And we give thanks for the way in which the NHS continues to value spiritual care, religious care, and chaplaincy. And we pray for all the chaplains who, alongside all the other healthcare staff, are at the sharp end of this continuing crisis, and we assure them of our prayers.